Well, good morning, everyone. Once again, welcome to another live and another great day. Okay, here we go. First up, Jeanette. Good morning from our staff. Michael. John from Elgin, Illinois. It's good to have you on this morning. Okay, Nativity. Good morning to you. And Andrea from Niagara Falls. Sherry. We appreciate it. Jerry, those Habs. Madeleine. Good morning from Temiskaming. How are you, Madeleine? Jordan. Happy Tuesday to you. And good for you, Jordan, for standing up in class yesterday and talking nutrition. Elsie and Len and Judy from Edmonton. Boy, bright and early there this morning. Good to have you on. Romy and Holy Nelly, Diane. Bonjour, Diane. And Beth, hold on. I want to see. I missed somebody up there. Roma. Good to have you on. Okay. And Yolande. Bonjour. Okay. Now that I've touched this thing, Donna and Jerry from Hatley, Quebec. Okay, we got another good story here, Connie. Another good study that came out. Not a study, it was actually new guidelines sent out to doctors. Debbie, how are you? And Jeanette, faithful followers. Sue, how are you? From sunny Florida. Good to have you on with us this morning. Sherry and Luella from Martin, Tennessee. Good morning, Luella. Diane, Lake Michigan in Michigan. Troy, our dear friend from Newfoundland. Good morning, Dr. Troy. Vicky, good to have you on. Shadia, Maria. Okay. And it's great. Okay, let's get going. Okay, so let me read to you and Catherine from Springdale, Newfoundland, and Monty from Newfoundland. We love you guys. Marlene and Johnny. Okay, let me read to you the guidelines published by the Journal of Post-Acute and Long-Term Medicine, okay? This is a journal. It's sent out to the doctors. These are new guidelines, okay, published by the Journal of Post-Acute and Long-Term Medicine, telling doctors to stop prescribing PPIs, proton pump inhibitors, like Nexium, Prevacid, Prilosec. These are the popular ones. They're telling doctors to stop prescribing PPIs long term. They were only made for short term. I know people that have been on PPIs for 20 years. Oh, doc, if I don't take them, I get acid reflux and I got GERDs and I got Barrett's esophagus, and I mean, it will just burn. You might as well put a match down there and burn the esophagus. Hey, I get it. But I've said this for a long time, and medicine is saying it now. They're saying to their own doctors, stop prescribing these long terms because the benefits that you get from taking PPIs, and we'll explain this in a minute, are outweighed by the side effects. Hey, that's medicine telling medicine, medicine telling doctors, look, they were never meant to be for long term, and we want you to stop prescribing them long term because of their major side effects. And this is part of the journal. It says here, they name 8 side effects that are very serious when someone is taking PPIs like Nexium, Prilosec, and Prevacid, okay? And you might have some other names that are in there, but these are called proton, proton pump inhibitors. Okay, here's what they said. Okay, here's what the article said. It increases your risk of heart attack and stroke. Imagine a medication meant to stop the acid from going up the esophagus increases your risk of heart attack and stroke. It increases your risk of hip fractures. It increases your risk of chronic kidney disease. It increases your risk, number 4, increases your risk of dementia and Alzheimer's. We're going to talk about all these things in a minute. It increases, number 5, your risk of lung disease. Lung disease. It increases your risk, and this is well established, this one, number 6. It increases your risk of osteoporosis, of course. This was the main one that they talked about even about 20 years ago. You know, that there was some warning, even put out on the labels of these medications. Be careful because of osteoporosis and hip fractures. It demineralizes the bone. We'll tell you why in a minute. Number 7, liver cancer. Liver cancer. Wow, that's serious. And number 8, iron deficiency anemia. Iron deficiency anemia. And I would put number 9, they didn't put it here, but anyone taking a PPI, meaning PPIs are proton pump inhibitors. So you have little pumps in your stomach, guys, okay? You have pumps in your stomach that release acid. Remember, your stomach is very acidic. It is a furnace. It mulches your food. So when it starts, the whole digestive thing starts in your mouth. You need to have enzymes and saliva and all these enzymes in your mouth that help, as soon as you start eating, it breaks food down. When it gets into the stomach, now the furnace takes over and it mulches that food down to, really micro-sized nutrients. It mulches it down, but you need to have high acidity in the stomach in order for your stomach to do that. And proton pumps are just releasing acid into the furnace. You get that. You understand that. You need that. The only place you should be acidic in your body is in your stomach. You want to be highly acidic in your stomach. The problem often is that you don't have enough acidity. When you don't have enough acidity in your stomach, your body overreacts to that. Your proton pumps release even more acid. The problem is when you don't have enough acid in your stomach and the proton pumps actually start overworking, guess where that acid goes up? It goes up the esophagus. And that's when you get that burning. And you got a little flap there. You got a little valve there that keeps the acid in the stomach. It's not supposed to let it escape and come up the esophagus, but a lot of times because of low acidity over a period of time, that little flap door doesn't stay shut. And so it opens up, and now the acid crawls up your esophagus, giving you major discomfort. A lot of people think they're even having a heart attack when they get acid reflux, okay? Look at all the side effects of trying to turn those proton pumps off. See, that's what PPIs do. They inhibit the proton pumps from even working. But guys, that's very serious. And it's well now documented that this is terrible for long-term side effects. Heart attack, stroke, dementia, Alzheimer's, osteoporosis. See, one of the things, think about this for a minute. Think about this for a minute. If you turn off the acid, remember your stomach is highly acidic. But if you turn that off, these medications work because they literally take your proton pumps and they stop them from working. What's the problem with that? Now you're not mulching your food. If you don't mulch your food, you're not getting the vitamins and the minerals and the things that you need. Now, you're not going to drop dead on the spot, but you really become malnourished. You don't have to go to the third world to be malnourished. You can eat unbelievably, but if you're not absorbing your food, if you're not absorbing your vitamins, if you're not absorbing your minerals, if you're not breaking down that food properly, then what happens is food goes into the small intestine, it's undigested, and it creates havoc in the small intestine. And you're not absorbing those things that your body needs. Now, like I said, right out of the gate, you're not going to croak. But over a period of time, you create some very severe deficiencies, and one of them is saying that it will affect your brain. It will affect your brain, dementia, Alzheimer's, it's because you need your nutrients. Your blood brings you your nutrients, but it only brings you what you give it. Your blood will bring the life of the flesh is in the blood. Your blood will bring you all your vitamins, all your minerals, everything that you need to flourish. Except if you don't have any, or you have very few. This is one of the reasons, and they didn't even put this down here. They talked about anemia. I agree. They call it iron deficiency anemia. Yeah, that can happen. Because even if you're eating a steak and you're not breaking that steak down properly, vitamin S, then you're not getting the heme iron that you need from that food. You're not getting it. We call that a malabsorption syndrome. One of the big reasons is the stomach. The stomach. And your body needs a vitamin, especially for your brain to operate properly, is vitamin B12. B12 is a finicky vitamin on the best of days. Why do I say that? Because its structure is very large. And B12, you can, if you got any kind of stomach problems, plus, especially if you're taking PPIs, if you're taking anything to suppress the acid in your stomach, you're not getting B12. You're not getting B12. It was shocking in my days of practice when I would tell people they were low in vitamin B12. Oh, doc, my doctor never said anything. And I said, first of all, the test for B12, blood test, it's 100 stinking years old. Let's give it a birthday party and put it to bed. I used to like the saliva test. And anyway, it doesn't matter. The point being is, I'm not even, although I've said it for many years, they're not getting at the cause of acid reflux or GERDs. They're not getting at the cause of it. It's just putting a Band-Aid on a problem. And now even the physicians are telling other physicians, listen, you write a script and you put a repeat on it for months and months and years, and, oh, you're doing all right? Are you doing all right? Yeah, I don't have acid reflux, doc. Okay, well then keep it up. And they're not even reading their own warning labels. And I'm going to say this. It bugs me. I'm going to say this to the pharmacists. To the pharmacists who should know better. The old pharmacist, there was a time when the pharmacist used to pick up the phone and challenge the physician. Challenge them. What are you giving? You're giving Susie here another PPI. Do you know that PPIs, and pharmacists know this better than anyone else, do you know, doc, that PPIs over a period of time, and even in those days, caused osteoporosis? It was well established. Hip fractures, because they only thought about bones at that time as a side effect, not cancer like liver cancer, not chronic kidney disease, but now it's well established. They're on the warning labels, and I call out the pharmacists who do not pick up the phone and call the doctor and say, you know what? I mean, this patient has been on this for a long time. It's time we get them off. Don't you think, doc? Yeah, but. Well, folks, let's look at the causes, first of all, of low acidity in the stomach. What causes the proton pumps to even increase the acid even more? Getting GERDs or getting Barrett's esophagus or getting acid reflux and all that. What causes that? See, I like looking at the cause of these things. The number one cause is what you're eating. 90% of the time when you have acid reflux is because you happen to be, I don't mean you, I mean the world out there. When people are carboholics, right? When people are carboholics, number one reason why they get acid reflux, where the proton pumps have to overreact in the stomach. Why? Number one cause. What is it? It is insulin. It's your body screaming at you, hello, Susie or Joe. You know what the problem is, Joe? It's your diet, Joe. The reason you have acid reflux is it's because you're eating crappy foods. That's the number one reason. And 90%, this is one of the things, even on the reset, people realize just how many carbohydrates and sugars they were eating. When they changed their diet, oh, my acid reflux is so much better. Incredible, isn't it? Incredible. That's 90% of the problem. 90% of the problem. A second problem is, and this happens quite a bit, okay, is the body is not producing enough pancreatic enzymes. You see, your pancreas releases insulin, but your pancreas also releases enzymes. Lipase, amylase, protease, okay? Lipase for fat, protease for protein, okay? And you need these enzymes, okay? You need these enzymes in order to mulch your food down properly. Enzymes are like little Pac-Man, and they get into the stomach and they break food down, and that helps big time, big time. When you're a carboholic and you don't have enough enzyme, because remember, if you're a carboholic, okay, and again, I'm not picking on you specifically, I'm speaking in generalities. If someone, that's what I should say, if someone is a carboholic, their pancreas is overworked. And when you overwork your pancreas, you get insulin resistance, numero uno, and numero duo, I think that's right. Number two is that your pancreas can't release the enzymes they are designed to release. The lipase and the protease and all these enzymes that help break your food down. Reason number two. But it really goes back to the diet again. It goes back to eating. Your body was never designed, guys. Your body was never designed to eat the amount of carbohydrates that we eat. Think about it. You know, it's near 200 pounds of sugar a year. That's a dump truck load. Your stomach, well, all of you, was never meant to use that much insulin. We overeat. We eat too frequently. And this creates havoc in the digestive tract and specifically in the stomach that we're talking about today. The proton pumps overwork, and they release way too much acid, and then they don't release it enough after. You've overworked them. Your body was never meant to eat, especially the crappy carbohydrates today. I talked to you yesterday about this. When the number one foods, calories consumed, and this is in the USA, but Canadians are no different. The number one is cakes, cookies, donuts, the number one food. Burritos, bread, noodles. Think about it. If you lived 150 years ago, 100 years ago, you didn't eat that stuff. I mean, look, I always tell my grandchildren, Grandpa used to have cookies and ice cream too, you know. You did, Grandpa? Yeah, when I was a kid, of course we had, but we didn't live on it. We didn't live on it. And then came the introduction of cereals into the human diet, brought to you by Kellogg's. And it was liars, liars, pants on fires. Oh, don't eat bacon and eggs. They can't be good for you. Look at them. They're full of grease. Yeah, your body likes grease. You want to lubricate your body? Eat oil, the good oils. And bacon oil and olive oil are the same. Just that bacon oil tastes better. No, but they're the same. Oh, don't eat so many eggs because you're going to get cholesterol. And they started this whole failed experiment, and it has been disaster. Heart disease. You would think, well, jeepers, guys, we stopped eating cholesterol. You would think, okay, well, we've eliminated heart disease. No, it's gotten 1,000 times worse. We don't have any more cancer because we're eating so good. We're having frosted flakes. They're great. No, they're not. They're bad. It's full of sugar. You know, oh, you got to have your greens because if you don't, Doc, you got to have, you know, if I don't have my fiber, because that was the lingo that got the world hooked. Oh, jeepers creepers, I need fiber. No, you don't. You need protein. You need fat because your body won't work properly. And you need cholesterol, and it only comes from the animal kingdom. So Dr. Kellogg's, who was a vegetarian, vegan, he was wrong. And I don't care what Netflix says. Somebody asked me a question yesterday. They sent me a link to a Netflix thing. I said, well, look, it's a religion, folks. It's not science. How could, think about this for a minute. How could red meat be bad for you when it's the only place you can get B12? How could that be bad for you? How could God put B12 only in red meat and then tell you not to eat it? How could that be scientific? How could you get a heme iron, Heme? It's only found in red meat. It's only in the animal kingdom. If it's there, and then they say, oh yeah, but you can't eat it. It's not good for you. And today, you know, hook, line, and sinker, the world went for the nonsense. And then they get Netflix or whatever, and they go, oh, yeah, you know, you don't need that stuff. It's not good for the planet. It's not good for you. Liars, liars, pants on fires. And I think they're very sincere. I'm not saying people are not sincere. That's different. I'm not questioning even their motives. They're sincere, but they're sincerely wrong. And I know I'm preaching to you guys, and I don't care. You can question me. That's what I'm here for. You question that. If you know, God gave you a brain, okay? Use it. But you have to think about things like that. But today, listen to this, I didn't even tell you this statistic. 60 million Americans, 60 million Americans are on PPIs, proton pump inhibitors. Guys, I rest my case. 60 million Americans. You see the pharmaceutical companies, and God love them, you know, they do some wonderful things. And if people would just, okay, I got some acid reflux, and for the next week, I'm going to take, Prevacid or whatever, and then stop, because I'm going to figure out what's causing it. But you see, you can understand, there's 60 million Americans are taking proton pump inhibitors. Guys, think about that for a minute. Must be a problem somewhere. But you see, when you look for love in all the wrong places, you're not looking for the cause of acid reflux. What causes it? The overuse of the pancreas. enzymes, and insulin. You wear the pancreas down, it still works, but it's not working like it used to. Now you don't have the enzymes. And you used insulin so much that every cell in your body is resisting insulin, and now it's affecting your brain. We talked about this, it affects your heart, it affects your liver, whatever. But one of the things it does, it affects the acid in your stomach. The stomach loses its natural environment to your diet. Numero uno. Number 2, I talked about, both of them are in the diet about the pancreas, okay? So really it's number 3, but I want to bring it back because, okay, one of them is, it's a bad diet. Number 2, bad diet, high insulin, not enough digestive enzymes. Got that? Number 3, or number 2 on the chart, dehydration. What? Your planet Earth, 75% of your body is water. Your planet Earth. Water. Your stomach needs water. Somebody asked me the other day, should I drink water with my meal? Well, I actually recommend you drink water. Yeah, I drink a little bit of water before your meal, but listen, I do not start my day. I won't even allow myself to have that first cup of coffee. That's all I think about. When I get up in the morning, coffee. But I'm a creature of habit. I know that while I was sleeping, I was becoming dehydrated. It's natural, it's normal, it's everything. If you are a carboholic, you are going to be even more dehydrated. Water. If you're dehydrated, one of the ways your body will scream at you is, hello, add H2O. You need water. Oh, Dr. Brad, I don't like water. I didn't say you had to like it. You will learn to love it. Your body needs it, and only water is water. Only vitamin W is water. Your body needs water. Every cell in your body needs water. The river don't move properly without water. And dehydration is a big problem with people, especially men. Men are so stinking stubborn, aren't they? Yeah, I don't like water. I gotta have my 6 cups of coffee. And you know what? If I was thirsty, I would drink water, but I'm not thirsty. Don't wait, you don't have a little red light on top of your head. It's too bad, Add water. Wouldn't it be nice if we had that? But it's amazing when you do start drinking water, then you realize how dehydrated you were. Because once you get that thirst mechanism working, isn't it true? Once you get that thirst mechanism working, you realize, oh, gee, was I ever dehydrated? And juice ain't water. Coffee's not water. Tea's not water. That ain't water. Gatorade ain't water. Oh, not it. Doc, it's got electrolytes. I don't care what it's got in it. It ain't good for you. Your body needs H2O, water. Your planet Earth. Your stomach needs water. Now don't, I'm not too worried about the odd person that might be drinking too much water. I guess it can happen, but generally, nah. You want to have nice skin? Water. Yeah. Don't dry up like a prune. No, it's just bad habits. And your stomach will appreciate it. Okay. So, I'm having fun again. I get my workout in the morning just thinking about these things. Okay. So 60 million Americans are on proton pump inhibitors. And medicine is telling medicine, cut it out long term. These drugs weren't meant long term. And the benefits you're giving to your patients are far outweighed by the side effects of people taking these medications. Change your diet, guys. Change your diet and start drinking H2O. And I'm a big guy, by the way, very big on taking digestive enzymes. I take digestive enzymes every day, especially as I get older. Amylase, protease, lipase, and all the blend. And I take digestive enzymes every day. I tell you, they work. Okay. Love you guys. This week, we will be on tomorrow morning again. Thursday, we're going to go in the afternoon. We're going to do an afternoon session Thursday. So tell all my Western friends. That's for you. Okay. In the afternoon, we'll go at 4 o'clock on Thursday. And Friday is question and answer. Friday is question and answer. Okay. So get your questions in. Hey, don't be shy. We'll answer your questions as much as we can, okay? And if you're not a member of the Martin Clinic Facebook group, then become a member. If you don't have this book, okay, #1 selling book in Canada, and I'm telling you, it's amazing. You guys have done that for us. We thank you for it. It's a great book if I do not have to say it myself. No, it is a good book. I think it's a wonderful book. Of course I do. Okay, love you guys. Talk to you soon.